Hi, this is Straight Talk with Roger Smith, and today I have Dr. Anthony Pottinger. All right, so I'm going to read Mr. Pottinger's bio. Dr. Anthony Pottinger is a gynecological oncologist based in Trinidad and Tobago. He specializes in obstetrics, gynecology oncology, with a focus on conditions like HPV, cervical cancer, and other reproductive health issues. Dr. Pottinger is affiliated with St. Clair Medical Center and has contributed to public education through various platforms, including social media and programs like Your Body and You. He holds degrees from the University of the West Indies and has been active in this field since the 1980s. Without further ado, let me bring my guest. Dr. Pottinger, how you doing, sir? And how was that bio?
I am great, Roger. And yes, it is okay. I'm glad to see that people saying not well, no unfavorable things about me.
That's a good thing. That's a good thing. So anyway, I'm really pleased that you're able to, bless this forum. I have some questions for you, sir.
Yeah.
And I have your formal AI questions, and then I have your Roger questions, so we'll start with the formal ones first. So, what inspired you to specialize in gynecological oncology, and how has your journey been? How did you get to where you are, sir, from Jamaica? And tell us about where you're from.
All right. So let me start from the beginning. I was born in Kingston, 1958. Um, I was one of those who were fortunate enough to pass the common entrance exam, which usually allow you to enter one of the high schools, and potentially, if you do well, you could spend 7 years in that school. So I didn't get through that, so I had to go to something called a junior secondary school for 3 years and then do another exam, which was called the grade 9 achievement test. I got through that one and then went to a school which was considered one of the prestige schools. I went to Trenchtown Comprehensive High School and spent 3 years there and then did the O levels. I did fairly well in the O levels, so I had to transfer again to another school because that school didn't have sixth form. So I then went to Kingston College, which is like a so-called prestige school in Jamaica, and I spent 2 years there for A levels. After that, I went to Mona campus in natural science for a year and then transferred to Trinidad in 1979 to do agriculture. So my first degree is in tropical agriculture. All right, worked in Trinidad for roughly 2 years and then went back to Mona to start medicine. After, well, while in Trinidad, met my wife. Um, we got married. Now have 3 children. So moved back to Jamaica in '84, and as soon as I could come back to Trinidad, I came back in January '87. So finish off the medical degree, which is called MBBS, Bachelor of Medicine and Bachelor of Surgery. And then I worked in various departments in the Port of Spain General Hospital from 1989 to 1994. And then I migrated to England in order to complete specialization in obstetrics and gynae. So I spent 6 years in England. After the first 2 years, I got through all my exams and we had to write a book and different things. Everything was approved. So I got what is called the MRCOG. That means member of the Royal College of Obstetrics and Gynae. And then I spent 4 more years in England subspecializing in gynecological cancers. Now, why I choose gynecological cancers is because while I was in Port of Spain doing rotations in obstetrics and gynae, I was actually reading things and so preparing for exams, and you know what was going on and best practice and standard of care with respect to the management of gynecological cancers. And I knew that what we were doing was deviating a good way away from that. And primarily it was with the extent of the surgical skills. So one of not a, well, she was a doctor 1 year above me. Subsequently became an anesthetist to do a lot of surgery with me. Her mother was diagnosed with ovarian cancer and was in the hospital under the care of my team. And the type of surgery needed, um, the radical and extensive surgery, nobody here in Trinidad could have done it, right? So you have to do something called you try to do a staging and debulking laparotomy, and the aim is to move as much of the cancer as possible, or everything that you can see grows. And when you do that, and then challenge them with combination chemotherapy, most people will do well. If you have advanced disease, it's not curable, but people can, even stage 4 disease, you can get 3, 4, 5 good years out of them. Because we couldn't do this, her mother didn't make it. Within a fairly short time, the mother passed. And then this was about 1990. And like I said to myself, you know what? So much better can be done, but we can't do it. So at that point, I committed myself to go down this line. So it started there. I hope
Wow.
that wasn't too long-winded.
No, 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 not at all, not at all. Um, why specifically Trinidad?
Well, my wife is Trinidadian, so at the time we couldn't the agriculture degree, and you had to come to Trinidad.
Okay.
So after A levels, I went to Mona 1 year because find out what were the best subjects to do in order to get into agriculture. We did the subjects. That was maths, chemistry, and botany, and then I came to Trinidad to do agriculture.
No,
But
I miss the love connection with Trinidad. That's the part I missed.
yes, so as my wife was in the class, you know what I mean, and then we
Same,
actually
same.
got married in
You kind
'83.
of leave. You kind of leave out. You kind. I missed that part of the jigsaw. That it was a love connection. Okay, okay.
All right, all right.
Anthony, how do cultural attitudes in the Caribbean impact women's health awareness, particularly regarding gynecological concerns?
Well, I think religion and people who have religious belief and religious persuasion and believe in prayer and all them things is a big bugbear because I have been I do a lot of lectures. Anybody, bank, credit union, church, whatever, local health center. Once they ask, I will go. And I remember one particular time I was in a health center and running a lot of information about cervical cancer and the importance of screening with the pap smear, etc. And was talking and touching on the need for vaccination and things like that. And at the end of the discussion, we're supposed to be question and answer. Most of the women there never had a pap smear or had a pap smear 10, 20 years ago. And the pap smear really should be started when people become sexually active by 3 years. You don't have to start it at 6 months or 1 year and thing. Because cervical cancer is due to a viral infection that everybody who ever have intercourse get exposed to it, man and woman. Over 90% of people will not have any problem because their immune system can clear the virus. Less than around 10% of people will have a persistent HPV infection. And if they're negligent and not doing the pap smears, you don't pick up things in an early stage when you can deal with it. So that was the message I was giving them. And it's like, remember one particular lady said she never done a pap smear and she's not planning to do no pap smear because, she covered by the blood and, her friend Jesus will make all these things happen to her and things like that. And that kind of attitude is quite common across most of the islands. And then another bugbear is the strong belief in alternative medicine, or what would I say, bush medicine. So people believe they must not access, screening modalities and things like that. So they can, rely on this bush, that bush in Jamaica, Cersei, bush in Trinidad, here about vervine, all different kind of things. And people will even have problems. When they have intercourse, they're having bleeding, or they're having bleeding in between the period, and will not access the medical services early, but will more go to somebody who's going to give them massage therapy or give them this bush to drink and that bush to drink. And a lot of time people will come in with a history going back 2, 3, 4 years before they come in. Oftentimes, and allow the thing to fester and spread, and sometimes beyond where we can cure things. So that strong belief in this alternative thing, and I don't know, some kind of fear of accessing the normal medical practice is a big problem all over. Um,
Wow. So that's interesting. And what's really interesting, it's amongst all the probably islands where the mentality is pretty much the same. Let me ask you this: what's some of the most exciting advancements in gynecological oncology that you've seen recently?
well, there are advances in surgery. So this is a primarily a surgical subspecialty. It's an elite surgical subspecialty. So if you're clumsy with your hands and don't have balls, as people say, to do risky surgery and relatively dangerous surgery, you can't really excel. So there, most of my surgeries are open surgeries, but you have minimal access surgery now. First with laparoscopy, and now you have certain robots that you can use that in a sense make the surgeries a little bit safer in respect to things like blood loss, and people can go home sooner and things like that. But it's not all gynecological cancers can be treated with the laparoscope or the robot. But so that was a big development, what they call minimal access surgery, not just for gynae, but for any surgery. Right, so people will have less pain post-op. They can go in a quicker time, recover to go back out to work in a quicker time and thing and so. And with respect to some of the cancers, early stage cervical cancer, the laparoscopic surgery are almost as good as the open surgery. All right, so that was a big advance. The chemotherapy, there's a big advance in chemotherapy. Chemotherapy regimens now are more effective and less toxic than they were like 30, 40 years ago. So like, nowadays, if you use a combination like something called paclitaxel and carboplatin to treat cervical, like ovarian cancer, after you do optimal debulking, 80-85% of the people will have a very good response, right? And that response can last for a good while. And it is that combination is very tolerable compared to some of the combinations they used to use in the past. There's plenty advance in radiation therapy also. You used to use what like cobalt or cesium radiation in the past that used to damage a lot of tissue, right? So you're trying to treat certain lymph nodes or so in the pelvis, and you damage up the bladder or damage up the bowel and things like that. And the amount, so there's a big scatter. So there's plenty advancement in that. Nowadays, you have what they call IMRT, right? Um, intensity modality radiotherapy. I think that is the right term, which is more pinpoint. So the collateral damage to tissues that you don't want to treat is much less, and it is computerized and better. People don't have to go into a room again with with a radiation source inside of them for 48 or 72 hours and all that kind of thing. So that is a big advance. So you have advance in surgery, advance in chemotherapy, advance in radiotherapy. Those are the traditional means. But now you have plenty advance in like immunotherapy. So you have been trying to develop, like what they call monoclonal antibodies to like target certain specific antigen in a cancer. All right. Now there was hope that 20 years ago that this probably could be the, nirvana. This could be the holy grail to cure cancers, but it has not turned out to be. But because the cancer cells can develop resistant to these things fairly quickly, and they're usually very, very expensive. Most people can't afford it, even if they have insurance. So there's a severe amount of what I call economical toxicity, and they're not going to cure you. And some of them might just buy you 3 months, 6 months additional, what we call progression free survival. So you can use these antibodies to target the blood supply to the tumor, different things. However, I think that was because we used to believe that most cancers are, generate from a mutation. So you have so we have been looking for genes that control these mutations that you probably believe was a few. So if we could have find out the gene and the mutation that cause cancer, then we could cure it. But it turned out that is not very few. It's probably hundreds and thousands of mutations, and the mutations are usually downstream of the original thing. So I think it's being accepted more and more now that most cancers are not due to some mutation, like breast cancer. Around 10% of the breast cancers worldwide is due to some mutations. Some of the best known ones are what we call BRCA1 and BRCA2. So these are some genes that's supposed to repair, DNA damage, regardless of what caused the damage. Could be radiation therapy or a virus or different things. Some drugs are even excess exposure to estrogen or whatever. However, it's only at less than 10%. 90% of the cancers don't have nothing to do with this mutation. So now we're realizing that the vast majority of cancers, any cancer, is actually a far downstream result of chronic inflammation, which has been happening usually sometime 10, 20, 30, 40 years. And it's this chronic inflammation, sometime in an immunodeficient person who can, all of us form cancer cells every day, 2, 3 times every day. But we immune cells when we're younger usually can recognize the cancer and take out the cancer. Now, after about age 15, our immunity start to decline, what we call the innate immunity. So the immune system have two major parts, the innate immunity and what is called the adaptive immunity. So the innate immunity start to decline from around age 15 for the rest of our life. So somebody who used to, for instance, get HPV. HPV is human papilloma virus. There's over 100 of them discovered so far. And 30 of them infect the genital anal region. And we know that 14 of those are called oncogenic viruses. They can cause cancers if they stay long enough. So somebody gets, say, something called HPV 16, and they have an immune system that can't clear it. And if that person negligent and not doing the pap smear, that could pick it up. If it left long enough, that virus there, it causes chronic inflammation and in our immune system that can't clear it. And over time, that chronic inflammation, we believe, is what will start to cause certain mutations. And if you have mutation and in an inflammatory environment where you like your some cells call it T cells can't get to the cancer to take it out, you find it can fester in this chronic inflammation, which is mainly generated by some cells called dendritic cells or macrophages or neutrophils, cells from the innate immunity. So the adaptive immunity can't get to it. So you find in this environment that cell might have a second mutation, a third mutation, and usually you need around, we believe, around 6 mutations in the cell before it make the malignant transformation. All right.
Doctor.
I hope I'm not
No,
getting
no,
too
no, no,
this.
no. You're very, very deep, and this is gonna make my kin farmer type questions even nicer because I like what I'm hearing. But what sort of advice would you give for women for preventative care um, to make sure that they're doing the best they can be doing to stay healthy?
All right. So the best advice will be general ones, and then we get to specific things. So everybody should be trying to eat what is called a healthy diet, right? It will be difficult for me to tell you exactly what a healthy diet is, but broad thing, we need to try to reduce the amount of carbohydrates, especially the simple carbohydrates. So we now know that glucose is one of the main fuel for the chronic inflammation which lead down the road to the cancers. So the high level of glucose can lead to overweight and obesity, and the obesity is associated with at least 15 different cancers now. And the obesity is a main part of the chronic inflammation that can cause the mutations that eventually go down the road to cancer. So having a good diet and regular chronic exercise, if you could keep a normal body weight, right, well, the body
When you
mass
when you
index.
say when you say normal body weight, there are some women that says, my grandmother was big, my mother was big, me big, my sister big. You know, what do you say to people like that?
Well, there's something called the BMI, body mass index. You can't make a scale that will cover all body types. Some people have small bones, some have medium bones, some have big bones. So some people have big bones, and I just said that everybody in the family big, so they won't fit into this little niche. However, if people, like for a woman, really ideally we don't want like the waist circumference at the navel should be less than 35 inch, right? If it getting bigger than that, we describe that they have something called central obesity, and the central obesity is tied up with fat inside the abdomen, which is called visceral fat, and visceral fat produce some chemicals called cytokines, and these are the mediators of chronic inflammation. I don't want to get any more technical because people will start to lose me.
No. But so it's ladies having regular pap smears.
No, I will come to that, but I want to say these general things first.
Okay.
Because if people try to eat right, regular chronic exercise, keep a normal body weight, get enough sunlight. The sunlight is crucial for producing vitamin D. Vitamin D is a very, very important. It's not a vitamin actually, it is a hormone, and a lot of black people all over the world, even in the tropics, are deficient in vitamin D. And this is one of the main things that have the innate immunity handicap. So we can't deal with viruses and bacteria, and also we can't deal with cancers and take them out. So just by doing that, having enough sunlight, plus being out in nature, and fresh air and this and things, and the plants and them give out certain things that when we inhale all them things and relaxing and things. And so all these things are promotory to the immune system. And anything that promotes your immune system will protect you against cancers. So is regular chronic exercise, a proper diet, get enough sunlight, make sure you drink enough water, that you stay hydrated, not get dehydrated. It's important for people to get a good night's sleep, at least 78 hours of good sleep every night. People who chronically getting 3 hours and 4 hours and things, they're decimating their immune system. And when the cancer turn up, the immune system handicapped to recognize it and take it out. So beyond those general things now, I mean things like we avoid things that we know are chronic irritants that will lead to cancer. Smoking is the biggest one, right? Alcohol, all them kind of things. Stay away from it, right? If you could do all of that, all right, cool. Cervical cancer is second only to breast cancer in killing women from cancers in Trinidad. Right, and we have a simple test which has been around now about 80 years called a pap smear, which if you come in, see, people should start doing the pap smear by 3 years after becoming sexually active. And you do the pap smear, we use a brush to collect some cells from the mouth of the womb or the neck of the womb called the cervix, put it onto a glass slide and fix it and send it off to a cytoscreen or a pathologist. And they know will examine this under the microscope at high magnification, looking for the early cancer changes or looking for features of the HPV virus in the cells. If we pick this up and it is showing some of the more serious features, what we call a high-grade squamous intraepithelial lesion, that person should know this referred on to have an examination with a microscope, which is called a colposcope. And you paint the cervix with certain chemicals, and if certain abnormal patterns show up under the microscope, like in my practice, I give them local anesthetic and remove the abnormal area right in the office there and send it off. Now, if you send this off, this is what we call the precancer lesion, or something called CIN1, which is not really a precancer lesion. 99% of the time that will disappear and go back to normal. But when you get CIN2 or CIN3, these tend to hang around and can persist and go down the road at a higher percentage. If you have CIN3, somewhere between 30% to 50% of the time, it will go on to invasive cancer. So if people do the pap smear, we pick up the thing in the early stage, because it's a long stage before in this pre-cancer stage before it become an invasive cancer. It could take 40, 50 years. So if people doing the pap smear at least on a 3-yearly basis and all of them normal, When my patients reach 50, I could tell them, say, all right, your immune system telling us that it can deal with the virus. And because these things don't happen overnight, it's not like you're going to fall off a precipice. I could increase the interval to every 5 years. But I don't encourage my patients to stop at any point in time. You will find some guidelines saying you can stop at 65. I don't do that because I have had patients in the 90s, in the 80s, in the 70s who come down with invasive cancer, even if they have been celibate 10, 20, 30 years, because you could have a virus from you were young that your immune system keep it in check. And as you grow older and the immune system wane, can't keep it in check, the virus reactivate and do what it do. So the pap smear is essential. Now we have vaccinations. We have some vaccines, good vaccines against the HPV viruses that cause cancers. All right. And those studies with you have two main ones. I don't want to call a name, but one of them, the studies go up to 55 years. And next one, the studies go up to 44 years. So in people up to 44 years, like in the one that is in Trinidad, if they get vaccinated, they will still respond. But as I say, the older we get, the less the response will be because the immune system wane and is a bit handicapped. So ideally, yeah, a girl or boy before 12 years old, or definitely before 15 years old, if they all of them could be vaccinated, cervical cancer are all of the cancers related to HPV, like vaginal cancer, vulval cancer, anal cancer, lip, tongue, and throat cancers. All of those things potentially could disappear.
Wow. Wow. You know what? Were you always this deep, Dr. Pottinger?
You'd have to ask my friends and them that from school.
You know, I'm definitely gonna do this. So on a lighter note, let me find out certain things from you. Are you religious?
No, I'm not.
You're not. You're not. Do
No,
you classify yourself in any way?
no, if anything, I'd probably say I'm spiritual. I try to do as much good as I can every day. I try to help people. If people come to me, it might sound, I don't want to say I'm some kind of saint or sage or anything, but a lot of time people will come to me with cancer and they really don't have the funds, and especially they're bleeding heavy and I know what to do. And if I don't do what I have to do, they're not staying around here long.
Right.
I will actually use my own funds and do surgery. And I'm not talking about much joke money. We're talking about 100,000. I'll
So
go for
Doctor
100,000.
P, you could be like
Yeah.
me then, because I don't have, I'm not a religious guy, you know,
Yes.
but I just want to be a great guy. There's I know that there are so many things in this world that I don't know.
Yeah.
That when you come to me with a little story, a mankind feel good story, I say, no, no, no.
Yeah.
That's so minuscule to whatever I see, what I think is going on, what we're living in. And I don't know if a lot of people are willing to talk about that. You know what I'm saying?
But you see, your philosophy is similar to mine. You see, once you know compartmentalize yourself in them kind of thing, and I don't want to start bash nobody, it might start to come across. But in fact, probably I should shut up my mouth and don't go down that road.
Yeah, yeah, yeah,
Because
yeah,
when you
yeah.
go down
No,
that
no.
road, it makes people can get turned off, like I'm making them look like they're stupid.
Yeah, yeah, yeah.
So I do what I got here, but I
No, no,
try
no.
my best
Well,
to do as
it
much
takes
good
all
as I
kinds. It takes all kinds to make a world. Let me ask you this much. So even though you have a specialty in gynae,
can.
when you have a friend that comes to you and he has prostate cancer, are you telling me the same story is about healthy, live healthy, don't try not to drink too much? It's the same story amongst all
Yes,
cancers.
that thing is the same story. And in fact, the chronic inflammation is the same story for prostate cancer, colon cancer, lung cancer, anyone. So the irritant for lung cancer, we know that cigarette smoking is a big part of it. Any smoking. Or you will have people who never smoke. We know if people in building with asbestos and they get asbestos in their lungs, it can take 10, 20, 30 years with the asbestosis to start causing the cancer. So any chronic irritant, right, can eventually lead to cancer. So like with the prostate cancer, we don't know exactly what the irritant is, but there are good studies that show that the same HPV might play a part in it because like some studies came out of Australia where when they look at the prostate cancers and check for the viral DNA, as much as 70% of the invasive prostate cancers have the same HPV 16, 18, 45 in it. There's another study that look at breast cancer and looking for the viral HPV. And when they check 53% of the cancers, they could find the viral HPV. So we could be dealing a lot of viruses that we can't clear will cause cancer. Right. You ever hear about a virus called HTLV1?
No.
Well, that virus, a lot of the work we discovered, and it was done right here in the Caribbean and also in Japan. So that virus is associated with leukemia and lymphoma and those things. Right. So HTLV3 is what we call HIV. So you have HTLV1, HTLV2, and then HTLV3, which they name as HIV, and it's two of them. So you have HIV 1 and 2. Then you have something, you ever hear about something called hepatitis B?
Yes.
Right. People who have that is a chronic inflammation in the liver that causes hepatitis, and over a long period of time, you can get cirrhotic liver, and it can end up with what's called a hepatoma, a liver cancer. But you have other viruses too. They used to realize that a lot of the liver cancers, you can find the hepatitis B genome in it, but then some cancers you couldn't find it in it. And then they used to say in the past, they call it, you have hepatitis A, and you have hepatitis B, and then they will say hepatitis non-A, non-B, because you was having the anything named itis mean inflammation. So the hepatitis is inflammation of the liver, but they couldn't find A or B are in it. So they used to say it's non-A, non-B. But then eventually that was discovered, and it got a name and called hepatitis C. They are vastly different viruses, vastly different. And each of them could cause the cancer.
So let me ask you this. So do animals have cancer at the same rates as humans?
Only the domesticated ones that we feed like how we feed. An animal in the wild that eating the natural things, almost unheard of for them to get cancer or heart disease and diabetes and all them things. But the domesticated ones where we feed in like how we eat, right, will get cancer. All the pellets and them we're giving them is the same soy and corn and all them kind of things. The same sad diet, the standard American diet.
Right.
So that the diet is crucial in it, in the explosion of the obesity, and then the obesity lead to chronic inflammation. The obesity cause people to have higher exposure to estrogen. We know estrogen is a growth hormone that can promote cancers. So like for the woman, is a vicious cycle.
So doctor, tell me something. Without cancer, how long are we supposed to be living? I mean, something has to take us out.
Yes, so it is believed you have some on the chromosomes, right? You have the ends of the chromosome, like your shoes lace. You have the little tip on the end of the shoes lace, right? To keep the shoes lace from unraveling, okay? They call it the telomeres. And from the length of the telomeres on our chromosomes, it can be calculated that most of us should be able to live to about 120 years healthy if everything is done right. Okay?
Hey, guess what? I hope your pension good because, boy, no, but me, I hope your pension good because, boy, how many years that?
I targeting at least 50 with my mind intact and my muscles working and my skeleton working so we can get up and move and things.
Nice.
So it will be ideal. It will be ideal if all of us live healthy, not living long, but the last 30, 40, 50 years we're sick and we're bedridden and we can't walk and this and that. So the lifespan is not so important. We should be talking about health span. So if we can reach to the point where we can say the most of us can live to 100 years, but healthy, not in nursing home and sick and can't walk and things and so from within with 60s and 70s, you know, it is possible. And most people, if we can get past the kind of way we're eating right now, we're generating the chronic inflammation, we're generating the cancers. If we could, because the accepted current theory is the mutation, the somatic mutation theory, but it is getting more and more obvious now that that is a downstream thing. The upstream thing is the chronic inflammation. And the chronic inflammation tied up to a large extent with our diet and the lack of exercise and the lack of sunlight and all them kind of things.
Tell me,
So with this information coming out now, if more and more people adapt it and step off of the treadmill, what leading down to diabetes and hypertension and heart disease and stroke and cancers. Yeah, the 120 years we start to becoming more thing. But then you guys say, no, oh, we gonna feed ourselves.
no, no, no. I'm not gonna say that to you. What I am gonna say is, do you ever run across someone that, and everyone has this age and a certain level of ability, that you tell them, you have stage 3 or stage 4 cancer, and does this person ever look at you and say, "Can you just give me a little bit of morphine and let me go quietly," rather
No,
than wait, rather than chemotherapy, radiation, and you rinse out them insurance and you rinse out them insurance, take away all the money from them grandchildren,
yeah,
but them are dead still.
yeah.
What do you
That is,
what is your advice to the person that
all
just
right.
wants to go quietly?
I hardly ever see it. Once people have get diagnosis, and they always want to do things. But I am not one of them doctors who just stay and the things they just mention because I'm trained that way. But my mind is open, so I deal with alternative things, but not stupid things. So you find like that picture where you just paint is classic for America, where it is just crazy. It's capitalism and steroids. So you might have somebody, a good job that will help somebody, but you have to have $100,000 a month.
Wait,
It's
Dr.
just,
Pottinger, this is not a career for you? You really care?
yeah, man, I care. I care plenty. In
Oh, in
fact,
America, in America here, man, you see the Ferrari, you see the Ferrari and the Porsche. You
nah,
know what this is about. You
let me
know.
tell you. Let me tell you something. Sometime like today, I saw one person for 2.5 hours, and I just charged them a normal office visit, whereby you have some GPs might be charging something similar. But it needed that length of time for me to fully explain to the person that they come with a lot of investigations and things where they had from previous doctors, which I didn't fully understand. So I don't like to be misunderstood. So I will spend that length of time, right, to make sure people understand and explain a lot of things to them. Nutrition, the fasting, all them kind of things, explain to them about insulin resistance, the obesity, the sleep. And with all of that, I explain to them how important vitamin D supplementation is, the sunlight, right? Some people today, the person today was really overweight. I was explaining to them the importance of using metformin. Metformin is a frontline treatment for like type 2 diabetics, but it has a lot of other roles just apart from that. And it is one of the things that it is a powerful anti-cancer drug, you know what I mean, and very cheap. But big
Can,
pharma won't push something like this.
can I ask? I want to ask some questions about you now
Yeah.
because we've gone very technical. So, so do you have any vices?
Not really. I know I am not a smoker. I don't smoke nothing at all. And not really a drinker. I will drink 2 beers. Really, me go more than two.
But
You
when
know.
someone smokes, or takes some sort of substance to whatever, how do you feel about it? Do you look down at them, or do you understand that everybody needs something?
I am not judgmental, but with the information I have, I'm trying to educate people and teach all the time. So, like for instance, I was on the front line here in Trinidad to try to get the cannabis decriminalized because I know that was demonized in a big, big way from where you are without good medical evidence. And so many people's lives have been destroyed. For a little spliff tail, them have to go to jail and then police record and all kind of thing and send them on a path where it's just, you're destroying a life. So, but I encourage people not to smoke it because this plant have a lot of medicinal benefits. So if people will use the extracts, the oils, like especially we make the oil and the oil is with the solvent is coconut oil and it have a lot. I will tell them how to use it and to how to start at a low dose and how to titrate it so that they can get adequate sleep. Those who have insomnia and not sleeping. All right. Those who have chronic pain, arthritis, and them things, certain autoimmune diseases. Even some of my cancer patients, I will do the best at surgery, good as anybody else in the world. And some people will say they don't want the chemotherapy, right? So, but
But
yeah,
Dr. Pottinger, what you didn't answer me is are there people
very
that
rare. As
say
I said, very rare.
no for
Anybody,
real?
I can,
But what if
yeah,
you're in
very, very
pain?
rare.
If you're in pain, they don't just want to go.
No, you see, because I explain to them that you have things that can deal with the pain. I've never had anybody come to me where I tell them, what you're stage 3, or stage 4, and they say, boy, let me just go and go roll up and dead. No, no, no. And most cancers don't cause pain. So a lot of cancer patients doing that plenty pain. Occasionally, like cervical cancer, if it's spread to the bone and thing, and so you can get bone pain and thing and so. But by and large, cancers don't cause pain. But it's not very frequent somebody will say, boy, I me go and roll up and dead. And most times, even when I have stage 4 disease and they don't want to use the standard things, then I go to alternative things that work. The cannabis, same ivermectin. There are some things, mebendazole, fembendazole, high dose vitamin D,
Hey,
and the
me glad say me have your number. If me ever get sick, you me because when you say cancer no painful, me I say, but wait, me think say cancer, why
no, no, no. Most cancer is not painful, and especially in stage 1, stage 2, very late stage 4 cancer. If it into bone and them things are, it compressing something, blocking up your ureter, so the urine can't pass, so the urine back up, and then damaging the kidney. Some of those will get pain, but by and large, most cancer is not painful.
So, doctor, when we die, what do you think happens to us?
We just our elements just go back to the universe, and universe recycle it.
Okay,
We make
so
up of
also
calcium and
there's
magnesium
no
and
afterlife then, huh?
well, I'm not into it. I have not seen any good evidence from my small fee. Most of those things, I don't want to get into it because we might start turning off people. Yes.
No, no. You see, what you have to realize is, there's a lot of people. It's like a matrix. You look at
Yeah.
someone and you say, "But wait, do you really believe that?" I'm one of this is what this platform's about. It's just to ask questions, have conversations, real
Yeah. Yeah.
conversations. Because guess what? Donald Trump in his inauguration, he didn't swear on the Bible, and a lot of people had a lot to say about that. And I'm thinking, what does it mean anyway?
Yeah.
Holding a
Well,
book.
like a Muslim would swear on the Quran, or you know what I mean, or some other person might swear on something. But all that swear. What did he swear on anything at all?
No, you know that man. You know that
Yeah.
man don't believe in all that stuff. And to be honest with you, I can relate to it because I'm like asking the same questions. From morning. From I was little at.
No, I mean, I think when people very religious, gotta get brainwashed from young before they can even read and understand, they start to drive certain things in their head, and it just become it's almost like a certain part of your brain will control critical thinking and reasoning and logic get dampened down. So
You,
I know some very very bright people, they memory good, they can read and regurgitate, but when it comes down to critical thinking with respect to their religious belief, they just like it just switch off.
no, and I've spent a lot of time trying to deal with it because especially when you have really good friends of yours and you have these discussions, and I'm glad this is all part of cancer as well, because it's
Yeah.
about this whole belief system. But
Mm-hmm.
you'll have very very good friends of yours, and you'll have a conversation with them, and they when you question their beliefs, you realize that the reason they dig their heels in, it's like you are criticizing their grandmother who believed, great grandmother, and then what I've realized is I've had to sort of rephrase the way I speak out of knowing all of this because these people, it's the same thing. We grow up seeing it and we've never questioned it.
Yes. So you see, with me, I try to reason with people and really the great grandmother, the grandmother, the mother, all of them were brainwashed in the same way. And you are too, so we have to break the thing at some point, you know. So if I can get through to people and we can break it, then their children have to follow the same path. Because I believe that this is a big part of what keeping people who look like you and me shackled, mental slavery. You know,
You know what I notice as well is even when you look in the church, you look at the obesity rates in the church, because when you're going home to glory, who cares what you look like? You know what I mean? And in my
But,
mind, no, but here's the problem: we don't talk about it. That's it. We don't talk about it. You know. So.
well, that's probably one of my downfall because I talk about these things all the time. I'm always trying to reason with people to get to them. But after a while, it becomes frustrating and just have to just let things be. So
Yes.
if
Yes. Yes.
some people comfortable, I don't like the term I use is dedicated ignorance. And if I am trying to ask you to reason and let's come out of this kind of thing, and you as an educated person comfortable with your belief system, just leave it be.
Yeah, out of respect, I like to. So for my platform here, I want to be able to talk about these things, just like me and you are. And
I
and and,
fully
and
agree
if you
with
have
you.
another view, I want to talk about it. Really,
Yeah,
we have this
yeah,
way where we just back up and you're not part of Fimi club. I'm not part of your club. You go Calabar, me go KC, you go
yeah.
Georges. All of a sudden I'm like, wait there, you're a green shirt man, me a orange shirt man.
And you have purple blood.
Yeah. And I'm just wondering, when do we talk the way me and you talking now? You know what I mean? And we don't have to agree. The
Yeah,
other
yeah.
day, I was thinking to myself, my mother, she's a Christian, and she's able to bridge all these gaps in her mind with happiness, no matter what good, anything good. Jesus, he can't lose. Even if he does something bad, it was his will. You know what I mean? And
Yeah.
and I think to myself, but it gets her by every day. She worries
Well, that's what
about
I'm saying.
nothing.
The people who like that, sometimes better just leave them be.
I think it's
Because
healthy. No, but I think that's healthy.
yes, you see, and sometimes you can pull the rug out from other people. So they anchored to their belief system, and sometimes if you try to get them out of that, it's almost like you're snuffing them life out. So I reach to a point now. I have been like this from I was a little child. It just the stories and them just never ring true to me. You understand? So I don't know if I come from a different planet, but man walking on water and talking to 5,000 people and have no megaphone and healing the dead and all them kind of things. It just never did wash with me. Right. So probably me had some kind of genetic mutation. You
No,
understand?
I hear you. I
But,
hear you.
but for those people who comfortable with this and by trying to explain things to them differently, if it causing them distress, I have learned over the years, just let it go. Yeah.
So, someone, I need to know from you. Has someone been diagnosed of cancer and have gone home and they've ignored what you guys have said and lived a happy life because maybe there wasn't any cancer there? Who knows? It was a false positive. Have you heard of any stories like that?
No, in my practice, I go have no false positive. I'm extremely thorough. And when we make a diagnosis or people decide that they don't want to have any surgery or they don't want to do anything, I then switch and get into palliative mode. So if that person not sleeping good, I will start to talk to them about the cannabis oil. If they have pain in any kind of way, I start to deal with them with respect to the pain management. You understand what I'm saying?
Yes, yes,
Um,
yes.
and so you can keep people fairly healthy that they not deteriorate in a big set of way until they go. But sometimes it can be very distressing to the family members who have to see their mother withering away, bleeding or probably having pain
So,
or
so how comes you don't see it like a death sentence the way the layman does? You seem, I'm not going to say you're blasé about it, but you treat it
because
like
because
it's something that can be cured.
I'm dealing with this over 30 years, and I have hundreds, if not thousands, of patients who have been cured from cancer.
Okay.
Because if you get, especially things like cervical cancer, if I catch it in stage 1 or 2, and nowadays even up to stage 3C1 levels and things, I have plenty patients who cure. And we consider cure if somebody have no evidence or anything with 5 years. And I have had people like that with 5 years, 10 years. I have people. Uh, there's a patient I'm thinking about right now. When May this year will make 20 years since I did her surgery for a stage 3C1. That time they never used to call it 3C1 because the lymph nodes wasn't involved with it at that old time classification. But in present day classification, she had a stage 3C1 and she's alive and well and cancer free 20 years later. And I have many, many like that. Endometrial cancer, that is cancer up in the womb, 80% of the time, if people don't ignore postmenopausal bleeding or intermenstrual bleeding and they come in early into the biopsy and make the diagnosis, 80% of that will be in stage 1. And the vast majority of these people will be cured from the surgery alone. Those who gone beyond the uterus, you then can treat them with the surgery, chemo, some might need radiation, and I have many, many patients with endometrial cancer, even stage 3C1 endometrial cancer, who are cured well beyond 5 years and well. So
Dr.
it's not
Pottinger, I get the
a
feeling that you're never going to retire. Not,
I'm
not,
not
not,
looking,
no. I
I'm not
just
looking
feel, I just
forward to
feel
it.
that you're so sharp that you can't keep on going for another 20, 30.
Well, I tell you, my plan is to reach 100. And
Just 100.
yes, we don't mind intact. I'm a physical activity good too.
Sure.
I train a lot, So you were talking about like vice or something. I tell you, I don't have a vice. My vice is chronic training.
And what kind of training you doing?
Well, I have 2 black belts, right? And I used to compete plenty, but I retired from that now from 2011. I have a decent home gym where we run regular training Sundays, Tuesdays and Thursdays, where friends, it's not a paying gym, it's for my friends and brethren them and thing. And we train. So most of the guys in the gym, my son train too, but he's one of the young ones, right? Like I am in my 67th year, but physiologically, you have some tests you can do now to see what is your physiological age as
Age, yeah.
opposed to chronological age. And I'm sure, in fact, I'm going to try to see. You can't do it in Trinidad right now, but I will look into it. I would
Don't worry,
like
man.
to.
You look 40, man. You're all right. Hey, you see, if you put some what they call it, shoe block by your beard, man, you're good to
No,
go, man. You're good to go.
no, man. But seriously, I mean, my hands not tremble and all them things.
Uh-huh.
I am quite fit. I don't want to brag. I can share some videos with you when we finish. I mean, just Sunday, me and my son and another virgin who will be 69 next month. And we were working out seriously. And I was squatting with 255 pounds.
Okay, nice, nice.
I weigh about 160 pounds.
That's
Yeah,
good.
and
That's good.
yeah, you see, I will send you some video. I was doing bench press with 60-pound dumbbells.
Well, guess what? When you go to heaven and you get your 9 virgins or whatever they got and all that honey and milk, you're gonna need all of that weight training, so all of that.
And
Hey,
with all of
doctor,
that, you eat
good.
right. You realize I'm not a bodybuilder.
Uh,
I am not big, but I will send some pictures to you,
yeah, man.
our videos video with my shirt off, and you will see I'm a fat for me. Yeah.
Anyway, Dr. P, I'm really grateful that you blessed my forum. I really wanted to, the parts of the conversation that I enjoy, is when we talk about the layman stuff, because a lot of the technical stuff I
I hope
think
I wasn't getting too technical there.
no. I think it's all all advice is all good advice. You know what I mean? But
Yes.
sometimes, as I said, some people look at cancer. They may go home and say, "Boy, doctor said me have cancer," but me not listen to the doctor. Me get on about my business. Me not feel no pain.
No, man, I not. In fact, just recently, within the last 2 weeks, a friend from Jamaica reached out to me because he having some issues, and he called me, and I said no, some other thing not adding up, and he send pictures of all of your things. Them, so him send, in WhatsApp me pictures of him ultrasound, CT scan, PET scan, biopsy reports, blood vessels report, this, da, 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 da. and knowing to him, he have stage 4 prostate cancer.
Wow.
And I don't know why the doctor wasn't explaining to him a certain things. Well, anyhow, me not like keep people ignorant. Some people believe it better for people not to know the full thing. And so, but I tell him what the situation is, and then I carry the thing to a different level now, because I don't want to brag. I'm not the normal run-of-the-mill doctor who only deal with the straight line things. There are a whole heap of other things that can make a big difference. So I write out the whole planner and management field, from nutrition, exercise, vitamin D supplementation, ivermectin, everything, or you must eat, explain about ketogenic diet, carnivore type diet, weaning off the carbohydrate, all kind of things. And I wouldn't be surprised if this virgin within stage 4 cancer will be here in a good condition for a good while to come.
Hey, Dr. Pottinger, I need to find one of your website them or your
I will send some of the things them to you.
please do, because we have to put this in the bio so everyone can see. Once
All right.
again, thanks for blessing the forum, sir, and it was really a pleasure talking to you.
And thank you, Roger. Yes, this was nice.
Nice.
Okay.